Welcome to our first presentation that's called Something in the Water. Were you all able to get handouts? They are here if you haven't. Today we're going to do a workshop on hydrotherapy. We will have a 9:30 session, more the history and the background and the benefits of hydrotherapy. And then an 11 o'clock session on demonstrations. We're actually going to demonstrate. So we have a full-packed workshop today. Tomorrow we're talking about natural remedies. And so make sure that you come for that. Behind me here I have 10 health principles that spell out the new life. And those we're going to talk about in the first session tomorrow morning. And then we will do herbal remedies and food as medicine later on. I have with me a couple of friends. First of all, my name is Magda Ciocazan, and I'm a massage therapist and lifestyle coach in Bonners Ferry. I do a lot of seminars and outreach type activities in actually this whole Northwest. I do it in Washington, Idaho, Montana, different places, Canada. We had a cooking class in Canada a couple of months ago. And these are my friends, Shari and Brent Waggoner. And we have taken this show on the road a couple of times. And they are lifestyle coaches and massage therapists trained at Wildwood, have worked at Wildwood, and have worked at Eden Valley. Brent is also a master herbalist. He has worked in with herbs and natural remedies at Eden Valley, and they both have taught at different times lifestyle coaching and massage. So I'm very privileged to have them today because we didn't know they were going to be joining us. They actually left the area, and it was such a privilege to have them come back just for a short window when we have this. So thank you, and they will be joining me doing the demonstrations. So today, we want to talk about hydrotherapy. Leonardo da Vinci said that water is the driving force of all nature. And actually, there's another proverb that says, nothing is softer or more flexible than water, yet nothing can resist it. Isn't water powerful? Have you been to a Niagara Falls or something? Water is very powerful, and yet is very soft and flexible. And today we're going to talk about not just water on the inside, as you see here in the health principles that we need to have, but water on the outside. How can we use water for healing purposes? I do want to mention that this seminar is not intended to diagnose disease or to provide any specific medical advice, but you use this information, educate yourself, and use it in conjunction with your healthcare professional. So what is hydrotherapy? Hydrotherapy is the use of water as a therapeutic agent. Very easy. And the key thought that I want you to take away today is that we need to cooperate with our body to help speed up the healing process. Okay? Our body has mechanisms to heal. And when we cooperate with the body rather than against it, rather than shutting down those systems that help heal it, then our healing process speeds up. So that's our aim in doing natural remedies. I just wanted to also mention this Slovakian proverb. It says, pure water is the world's first and foremost medicine. Can you see all right? Pretty much? Okay. I just want to mention really briefly the history of hydrotherapy. Vincent Prisnitz was a Austrian farmer who treated himself for a serious accident by using cold water, and he also treated many other people. He wrote a book published the cold water cure in 1843. So that was a very interesting piece of history. Sebastian Kneipp, it was also a Bavarian priest who cured himself of tuberculosis with water treatments as well as diet. And he treated royalty as well as simple peasants alike as a lay healer. Wilhelm Winternitz is a physician that lived in the 19th century. He's a Czech-Austrian Jewish neurologist and hydropathist that is commonly characterized as the father of scientific hydrotherapy. And actually his work was influential too, and later became influenced by John Harvey Kellogg, which I'm going to cover next. And Dr. John Harvey Kellogg, as you know, was the director of Battle Creek Sanitarium, which was really a combination of a European spa, a hydrotherapy institution, a hospital, and a high-class hotel. He treated, Kellogg treated both the rich and the famous, and as well as the poor who could not afford going to other hospitals. And the sanitarium, or the SAN as it was called, drew really thousands of people from all the world. It included President William Taft, Henry Ford, J.C. Penney, Eleanor Roosevelt, and Amelia Earhart. There's another lady who used hydrotherapy in the 19th century and into the 20th century. Was Australian bush nurse. Her name is Sister Elizabeth Kinney. And she treated polio. She used wool flannel packs that were immersed in boiling water. They were wrung out and then applied quickly to the affected area. And they changed them every 2 hours and applied for a duration of 12 hours during the day. So that's just a brief history, but it really dates back to Roman times, Greek times. You've heard of the baths that the Romans had. We still have some ruins, and historians tell us about it. And so hydrotherapy really goes back a very long way, and as we go into the demonstrations, you'll see how Hippocrates used it and really saw the benefits. So what are the goals of hydrotherapy? Is to improve the circulation and the quality of the blood. Because blood delivers nutrients too, and it also removes waste from the tissues and the organs, and so hydrotherapy creates a peripheral pump, so to speak, which we'll talk about in a little bit, that moves the circulation. Its primary uses are in treatment of wounds, enhancing environment for exercise. So, you know, for example, like you want to exercise, but you get into the pool and that really helps you. It's like warming up. Really, that's called a warm-up. Before you exercise, you should warm up. I'm a massage therapist, but before I became a massage therapist, you always hear about warm up. And I thought warming up was stretching. I learned that stretching is not warming up. You should never stretch before you warmed up. So warming up is a hot shower, or a hot and cold shower, or a massage, or a walk, right? That's warming up, and then you stretch. Otherwise, you create more damage. So hydrotherapy is great for that. It's very good for pain, as we will see, good for edema, and it's just good for health maintenance. It helps your immune system. There are two therapeutic effects of hydrotherapy. There's the thermal effect. It's a cold application, hot application. And there's a mechanical effect, agitation. So a lot of times you have like whirlpool, you know, that also is very important. Also, the fact that we rub, that agitation helps with the therapeutic effect of hydrotherapy. Welcome, and if you have come late, please feel free and grab some handouts. You won't disturb me if you do. There are recording in the back, but you can go around. So like I said, hydrotherapy creates a peripheral pump. The hot and cold treatments to the feet and the legs create this pumping action to better return blood to the heart and to increase circulation. You always want to return blood upwards to the heart, right? You have the valves, the veins, have valves that are only one way. And so you never want to massage, for example, talking about massage, downwards. You always want to bring stuff up because you don't want to damage the blood vessels. So the same, this hydrotherapy creates this circulation in the body that creates a peripheral pump. And the reason why that's important is because circulation is made up of lymphatic system as well as your blood circulation. Those two make up your body's circulatory systems. And your lymphatic circulation does not have a pump. Your blood does, your heart. And so lymphatic circulation is helped by the aid of massage and also by the aid of hydrotherapy. There are limitations to our blood. There's only so much that we have. And it circulates, and a lot of it is in the lungs. And so there's a tendency for blood to congest or to pool in different parts of the body, as in the head or the pelvis. So if you have some pelvic issues, if you have headache, we will go over what are some things that you can do. But basically, a hot foot bath will drive away that blood pool away from the area where it's congested, and it will help you feel better. Just the short of it. I did mention derivation, or I alluded to this concept of derivation. And derivation is the ability to draw fluid, like blood or lymph, from one part of the body to another part of the body to, by application of heat over a fairly large area, for example, like a hot foot bath. So that's derivation. It's just to drawing away the blood from one area to another. There are some guidelines that we want to be aware of when we do hydrotherapy. You want to keep the feet warm during a treatment. So whether it's in a hot foot bath, we will notice during a more involved treatment such as fomentations, or just keep your feet in socks or whatever. I'm from Romania. I wear socks and sandals. My friend told me that doesn't make sense. You have sandals so you don't have socks. Yes, but I'm running through all this dirt. So anyway, during hydrotherapy, you don't want to be chilled. That's the main idea. The lower the temperature, the shorter should be the application. So if you're doing a big contrast with very hot application and then a very cold application, the colder the application, that should be the shorter. So 1 or 5 seconds, 15 seconds, etc., depending on what the therapy is. And also you want to train your clients or yourself to progressively react to the coldest application. In other words, I'm going to do a hot and cold shower. I'm going to start with fairly hot, and I'm going to go to fairly cold. You want a contrast. But next time I do it, I can handle more extreme. We want to avoid heat treatments for clients with multiple sclerosis. So if you have MS, you don't want to do hot. Warm is okay, but not hot. It will exacerbate the situation. So it's important to know the person that you're dealing with. Don't just do a therapy because you know that therapy is good. You have to acquaint yourself with who you're dealing with. Cold application should be preceded by a warm or hot treatment, such as a hot foot bath. And during any hot treatment, always keep the head cool. You don't want your brain to fry. And when doing contrast, always end with cold. So hot, cold, hot, cold. And we will go through the physiology of what happens in the body and why that is. So this is, therapeutic hydrotherapy. Of course you can do cold, just cold. As long as you're not chilled, you can do a cold shower, and that helps burn brown fat. Indications for hydrotherapy would be wound care, like if you have ulcers, soft tissue injury, burns, you can do hydrotherapy, and that will help speed up the healing process. Arthritis, limited range of motion, muscle spasm or muscle weakness, post-fractures after you have had an injury, tension, anxiety, or other psychological problems. We'll go over the wet sheet wrap. That is wonderful for things like that. What are contraindications? So we need to be aware of that. If someone has a heart dysfunction, you need to be aware of what treatments can or cannot be done with that. Respiratory dysfunction. A fomentation is great for someone with that, but a steam bath, they cannot handle it. So you have to be aware of some of the things that they cannot handle. Decreased thermal sensation or neuropathy. You don't want to do extremes with someone who has neuropathy. You can do a small contrast, but not a big contrast because they can't sense, the temperature. It might be okay for you, but that's one thing. The second thing is they do not have the venous return. They do not have the circulation is impeded and it's damaged, and so you will do more damage if you do extremes because they cannot handle it. Their body cannot handle the return and the going back and forth, the circulation. Severe peripheral vascular disease, again, same thing. If someone is bleeding or hemorrhaging, you don't want to do that because they will hemorrhage more. In an acute RA, in rheumatoid arthritis, it's another contraindication. When you have a severe fever or malignancies or uncontrolled bowel. Because remember, with malignancies, you're going to just keep, you're going to spread the disease, the infection throughout because you're increasing circulation. So as we looked at the history a little bit, I want us to actually look at did you know that there is an example? There are many examples, but I'm going to choose one in the Bible where hydrotherapy was used. And actually, this used more than hydrotherapy. It also used clay treatments and mud treatments. And that, does anybody know? Yes. Yes. Very good. So Captain Naaman, as you remember in 2 Kings 5:10, it says Elisha sent a messenger to him. Actually, the story goes that the little young captive girl was in the house of Naaman, and he had leprosy, and she said, "Oh, if my master would go to my prophet in my country." And so Naaman got a letter from the king. He went to Elisha. Elisha sent a messenger to Naaman, and Naaman was a little bit, distraught because his pride was hurt. This guy doesn't even come up to me to talk to me. I mean, I'm an important person. I'm a captain of the people that have conquered you, and you don't even come to me. And so his pride was hurt. Then the messenger tells him, go dip in the Jordan 7 times, and then your leprosy, then you will be, cured. He's like, whatever, this is crazy. I'm not doing this. And then his servant said, now wait a minute. If he had asked you some hard thing, wouldn't you have done it? And so he said, okay, fine. So it's good to have good friends, isn't it? That encourage us. So he did it. Why wouldn't he want to go to Jordan? That doesn't look very appealing, does it? The Jordan River was very muddy, very, not crystal clear like Jamaica or Aruba. I see your shirt there. Very nice. So you don't have that wonderful environment. Besides, he said, I can go to my own rivers where I have groves that I bow down to. So he was bowing down to his idols. But God said, no, you go here and you follow this. So he did. He dipped into the Jordan, and he dipped once and nothing. And he dipped twice and nothing. And he dipped 3 times. He dipped 7 times in the water. Why do you think he had to dip 7 times? The blessing was not on the first. The blessing was not on the second. The blessing was on the seventh time. There are other things in the Bible and in life that where the blessing is on the seventh time because God ordained it that way. And this actually, Naaman realized that there is a God in heaven and he brought him glory. And he was very happy because he persevered in this treatment. And this hydrotherapy experience helped him to be brought to the true God, to the Creator God. And so as you go out and help others in their day-to-day ailments, that will help them to see the healing comes from God, not from what you do. But you are an important agent to follow the things as they are given that will help somebody. So the key lesson in this, and in hydrotherapy, and in natural remedies, is frequency, perseverance, and faith. Natural remedies should be done frequently. You should have perseverance. If you don't see anything right away, persevere, and because you will see results. And have faith. Believe that they will work. Thomas Fuller said that we never know the worth of water until the well runs dry. And a lot of people are smiling because they've been on a well. But that is true. We don't realize how beneficial hydrotherapy is until we don't have it and you wish you had it. So I just want to talk about, okay, so is there some recent history where I have seen that hydrotherapy has worked? You might be wondering that. Well, in the Spanish flu, which is also called the pandemic of 1918, there were actually 50 to 100 million people, or 6% of the world population at the time, died, were killed by this flu pandemic. About 500 million people worldwide, which is a quarter of the population at that time, were infected by this. But yet, there were some areas in the country where people did not die and where hospitals did not have any casualties and they recovered, which was unheard of. In fact, I did a hydrotherapy presentation in Oklahoma with a family. His sister was a nurse in Maine at a lifestyle center in Maine. And what they did there is what we will show you this, in 1 hour. We'll show you the demonstrations. Is they did fomentations. So these are the key to survival. They did chest fomentations, and along with a nutritious diet and a balanced lifestyle. So they followed all of these health principles, along with frequent and perseverant hydrotherapy. So what happens in the body? How does the body work to help this treatment be effective? So it's recognized that it's principally the heat or the cold principle of the water that produces the result when it is applied to our body. So water has the ability to communicate and absorb large quantities of heat. It's a great conductor of heat, right? And conversely, cold water readily absorbs heat from contact with other bodies. There are certain temperatures. For example, very hot is 104 to 120. Usually, if someone has issues, just remember, issues, 104, no more than 104. And some people can handle more than that, 107, 110, they can handle up to 120. What I want to say is, here we are in an educational setting. If you are in an institute where you have doctors and nurses who have been trained well and they are overseeing the care, you can do extremes. Here, we're not going to teach extremes because we want you to, do this at home. But as you educate yourself more, and if you were in a situation where you had more oversight, then you can do more of these extremes. Also, very cold, it's 55. So 55 is a good temperature. So if you want, remember, 104, 55, those are good temperatures to work with at home. And in a supervised situation, you can do up to 70, very cold, 32 degrees. So again, you want to make sure that you are educating yourself. The very last health principle here, very important. What happens? Hot applications causes vasodilation. Your vessels dilate and more blood rushes through and come. If you have a big pipe, more water, more fluid comes through. Small pipe, less water, less fluid comes through, right? General effects of heat, of course, vasodilation, increased heart rate, improved oxygen delivery to the cells, improved mobility of white blood cells. This is key. You want to increase your immune system. And so this will be helpful in doing that. So with the rise of body temperature, the white blood cells move faster into the infected area. And ideally, you want to let the body temperature rise about 4 to 5 degrees above normal. And that's when the body temperature goes to, about 100. When the body temperature goes to about 104 degrees, that's when the white blood cells, have worked well. But above that, the white blood cells don't move as fast, so they're not as efficient. Okay. General effects of heat, it increases metabolism, body temperature, perspiration, lymphatic flow, mobility of the joints, and edema or swelling. So it helps with some of these things. Then you're going to apply a cold application. That's vasoconstriction. And cold causes the blood vessels to constrict to reduce the blood flow. And if the body becomes thoroughly chilled, the functions are slowed down or repressed. So you don't want the body to be chilled. You just want to give it an idea that it's going to be chilled so that it works, but not actually chill the body. That's why the cold applications are very short. The effects of cold are, of course, like we talked about, vasoconstriction. It decreases heart rate. It decreases metabolism, respiratory rate, and it reduces edema. And so you're creating this artificial pump, you see. So bring the blood in, bring the blood out. Bring the blood in, bring the blood out. And this is what happens on a cellular level. You see the blue cells are actually, phagocytes, etc. So these are also part of the white blood cells, your immediate immune system response. They are coming out of the cell into the tissues, going into the lymphatic system so that it goes to the affected area. If you apply a heat or a cold somewhere, the body's like, what's going on there? I want to check it out. I want to see what's going on. Clean it up. So that's what it's doing. So you're calling attention to an area, or you're calling attention away from an area. And if there's tissue damage that does happen during injury and infection, these will help heal. And of course, there's oxygen delivery to the cells. The pumping action and the alternating hot and cold hydrotherapy procedure tends to, carry away toxins and bring in nutrients. So the hot increases oxygen to the cells, and it causes vasodilation, which increases blood flow. So that's the blood. Now on the lymphatic part, the lymph is actually blood plasma, which has leaked out of the blood vessels, and now it's called lymph. Once plasma is out of the blood vessels, it's called lymph. And so your lymphatic circulation is increased with that. As you can see here, we have a picture of a person with normal feet, normal circulation, and a patient with diabetes. You can see here that on the right, that the circulation is not very good. That's why you don't want to do extreme hot and cold. However, studies have shown, and just recent studies I've just read a few months ago, where hot baths are very good, not extreme, but hot, are very good for people with diabetes. It helps them feel good and their body to feel better, to do well. I'm going to show you a picture of someone who has ulcers. And this person was treated at Wildwood with hydrotherapy, and he got better. I don't have the picture of afterwards, but that's pretty gruesome, and hydrotherapy helped with that. He was sent home, but he did not follow what he was taught, and so the ulcers came back because he has an underlying condition that's always there. So unless that underlying condition is taken care of, then you have to continue doing the treatments and also follow some of the health principles. So I just want to leave you with this. Cicero said, the competent physician, before he attempts to give medicine to the patient, he makes himself acquainted not only with the disease, but also with the habits and constitution of the sick person. So you have to understand what are the habits and lifestyle of the person that you're dealing with, or assessing yourself. Also, what kind of person am I dealing with? Am I dealing with a child or an elderly person? Or am I dealing with someone who's in their prime of their life and they can handle some of these things? So the treatments are, we're going to teach you, certain treatments, but you have to assess yourself, if you're doing it on yourself or a person you're working with. Who are you working with? Because you want to actually help that person, not hinder them in any way. And so some things can be applied very well on some people, and some with a little more caution. Okay, very good. So I went through that enormously fast. Are there any questions about what I covered? And if there are, I can't answer them. No, just kidding. My friends will answer them. I'm so glad that they're here. Yes, do you have any questions about some things? What you have in your handouts, maybe I can go through them really quickly. You have a resource sheet that gives you more, you can learn more about, buy some books and learn more about these treatments. You have some selected hydrotherapy, the one that's stapled, some selected hydrotherapy procedures that we will do right here today. Of course, you have the outline. You have the outline of what we're talking about today. And then you have some, one sheet, you have some cold and flu, herbal remedies, as well as some flu remedies with different foods and herbs that you can do to help during cold and flu. So there were a couple of hands. Shari.
Just because the slide said 120 degrees, just want you to know that at Eden Valley, 110 is the max. 110, 112 is for those who have been patient for a long time.
Yes.
What they're at. So
yes.
Just so you saw that number, I didn't want you to.
So let me repeat that so they have it on the camera. Thank you. Yes. Like I mentioned, you at home, 104 is good, 105. 110 is what they usually do, even at these institutions where you have supervised. And she was saying that 120, you saw on the slide, is only for people who have done this for many years. They have been long-time patients under supervision. So thank you, making sure that we do understand that. You don't want to go there. So 110 is max. And even that under some supervision. Even doing a hot bath. If I'm sick and I'm getting into the hot tub, I want someone to know. And we'll go over that. You had a question.
I know this is probably covered in the next section, but if I could ask it now. I have kids. The contrast showers, 3 minutes hot, 30 seconds cold. Me and my husband do that, but what I do for my kids, is that still a standard time?
Yes, and you can do it shorter. Shari, come up, please. Oh, we want to have you, Shari. Yeah, yeah.
Okay. My child always had croup every year, and my sister's child always had croup and went to the hospital. We never had to go to the hospital. We did hydrotherapy at home. Of course, when you're dealing with a baby, you are going to be mild temperatures. You're going to be in the shower with them, holding them, doing warm and cool, and you can end with a little brisk cold, cold is, but not extra cold like ice water, but just end it with cold. And then my husband, what he would do is I'd be at the shower, and then he would take her into the towel and then put her into, we'd have just a towel, her little blanket and some towels and her little diaper, and just put her down, wrap her up, and she would then cool down. And it's amazing what hydrotherapy does. She didn't have to have antibiotics till she was 4, and she had scarlet fever in Africa. So it works for kids too. And even little tubs. And when they get used to that as a baby, then when they're old enough to play, taking their bath, then we put them in little tubs, and we'll say, okay, now go into this one. And, they have their rubber duckies and everything, and so they're excited about it. And when they're sick, they say, Mom, hydrotherapy.
Thank you. Does that answer your question? Okay. Anything else? So we are supposed to break at 10:30, and it is about 10:10. Yep, it is. I believe that some of our things will take longer than the hour. So why don't we go into some, our next session and cover a couple of things, and then we have more time to spend on the things that take longer. What do you think of that? Okay. Yes, so she was asking about carpal tunnel. She doesn't have the pain right now, but she gets it sometimes. So with carpal tunnel, and this is not hydrotherapy, but massage. So it starts from here. You want to make sure that you release the pectoralis muscle and this thoracic outlet, and that might be where the problem is, or cervical. A lot of times they just snip your ligaments, and that does nothing. That will, so actually your whole shoulder girdle and pectoralis.
I would just second that because
You want to come here?
I would just second that with carpal tunnel, plantar fasciitis. There's so much you can do with massage. We had a lady, her name was Corolla, and she came and taught us. She was from Loma Linda area. She would go into the hospitals, do pain management with massage, and these people would walk away. They would think, oh, I have to have carpal tunnel surgery, and they would, of course, not have to have it, because it is, like Magda was saying, it's up here in the plexus, so where you need the massage.
Yeah. Reason I'm asking if someone has pain right now is because we're going to do an ice massage. So if you have a soft tissue, so not a bone, if you have a muscle that's been hurting you, and we can do a demonstration with ice massage, then you will see a difference between the way that you were hurting and the way that you won't be hurting. And it's also an aid if someone has chronic problems, a chronic issue in their muscular skeletal, that you can, it increases the range of motion you can do with that person later on. So it helps numb the pain, in other words, so that you can do more. So that's why I was asking, and if you are the only one, then we can, Shari, would you like to see where she has said the pain was, and to see if we can maybe help with that? So that's one thing. I just wanted to have an idea so that we have a volunteer when we do that. Okay, so our next presentation is our hydrotherapy practical applications, which we will do. And I just wanted, like I promised you, I'll be quoting Hippocrates. Hippocrates said, "Give me the power to create a fever, and I shall cure any disease." So when you, for example, when you're doing a fever bath, you will be creating an artificial fever, so to speak. And your body's like, wait, I need to fight here. There's some infection going on. There's something I need to do. And so your body will go into action, and your soldiers are going to go out there on the front lines and take care of whatever issue. And so, give me the power to create a fever, and I shall cure any disease. It's true. So the body will act and react. He also said, it is more important to know what sort of person has a disease than to know what sort of disease a person has. Because if you have a young person or a person with multiple, morbidities, multiple issues, elderly person, you want to not do a very severe hydrotherapy application, but you want to be more mild. You want to work, you want to help that person be invigorated, not dead. And so it's very important to know what person you're dealing with, not necessarily all the knowledge about the hydrotherapy. Although you should be knowledgeable, but go beyond that knowledge into dealing with the person you're dealing with. How do we begin treatments? There's a quote in the third selected messages, page 296, that says, "When treatments are given to the sick, simple, fervent prayer should be offered for the blessing of healing." And actually, we know in James 5:15 and 16 says, "And the prayer of faith shall save the sick, and the Lord shall raise him up. Confess your faults one to another, pray one for another, that you may be healed." So you start a treatment by prayer, because the healing and the power comes from God. We are just an agent so that God can work and can use us. When I do my massages in my practice, I ask people, is it all right if I pray with you? Right? I have had one person say no, but everybody says yes. And so they appreciate prayer. And if someone says no, then you pray silently that God can still help you and use your hands to help them. So we have now a plane or whatever it is. What time is it? Yes. 10:18. Okay. So should we do the ice massage on her? Or? Okay. So do you want to do that, or should we start this and do that at the end? Okay. I'll skip the ice massage and we can do that later when we decide. No? Yeah. I need to get the ice from my car. Okay. Yeah. So I'll just go into the contrast baths. So we'll cover contrast baths, and then we'll cover the rest during our session at 11 o'clock, okay? And our friend, someone called her because we were going to talk about that. So basically, contrast baths, You are in a jacuzzi and a cold swimming pool. Those are good, you know, ready to go kind of things. If you have a hot tub or a hot jacuzzi and then a cold pool, you can sit in the hot tub and then go to the cold pool and back and forth like that. 6 minutes hot, 2 minutes cold. 4 minutes hot, 2 minutes cold. 2 minutes hot, 2 minutes cold. Always keep the head cool. And you know, that's kind of the idea of a contrast bath. I don't have access to this, but I have access to a contrast shower. And so if I feel like a little cold coming in, or if I like this morning, I said, I need to get rejuvenated. I need to get ready for that presentation and carry all my stuff in. And so I took a contrast shower this morning. About 3 minutes hot and about 30 seconds cold. It's not exact. It is a science, but it's not an exact science. And you change it according to the situation. So I'm going to move around here a little bit. I turn it on to hot. So I wash my hair, I wash my face, you know, and I make sure that I get heat all over, all the time, hot, 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 everywhere. Then I don't turn it, I turn it towards cold, okay? You don't want lukewarm, you want contrast. So I turn it to what I feel I can handle, which is pretty cold, but not extreme. And then I go like this. And then your breathing increases, and you go everywhere, and of course you let it, you know, touch your face, and that helps rejuvenate you. And you raise your arms, because you can rub. And the reason I raise my arms is because you have your lymphatic nodes here, right, in your armpits. So you want your lymphatic nodes to be, you know, pumped and rejuvenated and everything. And you do that for a little bit. And then you turn it on hotter. You can handle now a little bit hotter than you did last time. Then you turn it on a little bit colder than you did last time. You see, you are able to handle hot and cold. Then I do it again. So you repeat it 3 times. If you do it less than 3 times, your body will not react. So you need at least 3 times. Now let's say I'm getting a cold and I don't feel very good. I'm going to do it 5 to 7 times. 3 times is minimum. 5 to 7 times is therapeutic, you see. Then Shari told me I need to make sure I rest, don't I, Shari? So because I used to just jump in the shower and then I just take off. So after every treatment, whether it's massage, hydrotherapy, after every treatment you want to rest about 20 minutes because that's when your body will be healing, okay? So there you go, rest. You can do like, I will cover tomorrow a little bit of an experience, but you can do this before the flu season starts just to kind of get your immune system going. And you can do this if you feel something that's not quite right. If you need to be rejuvenated, it's the end of the day, you've worked hard, you need to be rejuvenated, you can do this. It only takes a few minutes, and you're actually not wasting water because you're doing cold, not wasting hot water in between. So that's contrast showers. I just want to mention very quickly about a fever bath. And a fever bath is, let's say that I have a flu coming in, and I feel like, man, I think this is the flu. So I'm gonna go and fill up my tub, but you know the frog story, right? I'm gonna get in as the tub is filling. I'm not gonna wait because I'm not gonna want to go in when the tub is full of hot water. So I step in when the water is getting filled, the tub is getting filled, and I put some salt, like rock salt, sea salt, some sort of salt. Not Epsom salt necessarily, unless that's all you have. Epsom salt is good. It's magnesium. It's good for your muscles to relax. But just regular sea salt is good for the immune system to work. So I get in, I put that, 2-3 cups of salt, and I sit there up to here with the ice pack on my head, or a cold rag on my head, for about 20 minutes, as long as you can handle it, but about 20 minutes. Make sure someone knows you're in there. And then you make sure that, you kind of wash off really quickly that salt off of you. Dry off really well. Put on those socks and go to bed. Because that will help you sweat. And if you have been, sweating, change your pajamas. Just change your pajamas, your sheets. You will be sweating. And put on new pajamas, new sheets, and sleep some more. Because that's what you need. The rest is one of the most important things. And I know that Brent had something to say about that. If you want to come up. You put this on.
Okay. Now when you're dealing with, let's say, a fever, and there are some other things that you can do as well, but I have found a fever bath works really good to get heated up. If you feel a cold coming on and you're chilled, go ahead and take a nice hot bath, get warmed up, and then you want to go to bed, of course. But maybe before you take the hot bath, then after you get out, take a couple capsules of cayenne. Or if you're tough, just put the powder in a cup and swig it down. But this will help with circulation, everything. So I really have seen that work well for people by taking the cayenne, helping the immune system as well. Now speaking of going to jump on contrast bath real quick. If you're dealing with an infection, I don't think there's anything that works better than contrast. As Magda has already brought out, in your shower, when I feel a sinus infection coming on, or maybe you have an infection, a blood infection, something with an arm or a joint, hot and cold, whether it's in a bucket or it's in the shower, wherever it is, because you're creating a pump. By bringing the heat there, the vasodilation is taking place. You're bringing blood to the area with fresh immune system, fresh oxygen, fresh nutrition. And then when you bring the cold to the area, you cause vasoconstriction, and you're pushing that old blood away, making room for new blood to come the next time you bring hot. So you're just bringing reinforcements of the military, so to say, by your immune system to come treat and work with that area. So if you have a sinus infection, blast your face and your chest with hot and cold, hot and cold, hot and cold. You could do it for a minute hot, 30 seconds cold. You could do it for the longer time if the hot. Or you could just sit there and every 20 minutes just go back and forth. 20 seconds, yeah, thank you. It all will work. So whatever works for you, but the longer you can endure, the better it'll be. Hydrotherapy, just like Naaman had to humble himself to get in the muddy river. And he had to do it 7 times. To him it seemed foolish, but God blessed it. So I want to encourage everybody here, hydrotherapy takes work. And it also takes humbling, because you have to humble yourself to put the cold on the same area, right? That has just been so lavishly heated up. So you have to humble yourself. So I want to encourage you to humble yourself and to reap the benefits that you will get from doing the hot and the cold. It is really a blessing to the body. When doing a hot bath, you want to make sure that your heart is a good heart. If you have congestive heart failure, you don't want to get real hot because there can be complications, which has already been spoken of. If you have high blood pressure, and typically, I know at Eden Valley, if you were over 140, we wouldn't give the treatment, the fever bath treatment. Now, at Eden Valley, we treated a lot of people with cancer, and we used fever therapy for that cancer therapy. We used the hot and the cold. So, but we wouldn't do anybody over 140, and usually the 90 would be the limit on the bottom number, on the diastolic number. So if you were over 140 or 90, we wouldn't do it, just because we don't want to have any danger with anybody. Yeah, it'll increase the blood pressure, of course. Also for Lyme disease, it's rigorous, but it's a fever bath that'll last 3 hours, possibly 4 hours, at a very high temperature of 102, if not higher. And so you need help. You need trained people with you to keep the ice coming, to keep your head cool, and to keep the water at the proper temperature, to keep liquid going through you. Dr. Christopher used to give a tea to his guests that were in the fever tank, and they would ask, well, how much is too much? How do I know I've had enough tea? And he said, well, tip your head over. And he says, is anything coming out? And they'd say, no. He says, well, you haven't had enough yet. So you have to keep the liquids going. Very important. And I would recommend when you're doing a fever bath, don't use cold water, even though that is so nice when you're in a fever. You want to use lukewarm water, because if you're using cold water for drinking, it will cool you down. And you don't want to be cooled down, so you want to use lukewarm water.
Room temperature water for drinking.
Yeah, room temperature water. Thank you. Are there any questions right now on either the specific diseases or the treatments that we would give for them? Okay. Okay, thank you. Yeah, we want to, if you have someone in a fever bath, if you have someone pretty hot, you want to observe them. You want to have somebody observing you if you're taking your bath. What's your respiratory? Because usually people will speed up breathing. You'll speed up breathing because you want to be cool. You're hot. Every nerve in your body says, get out. You hate being hot like that. So it takes a lot of work to stay in a tank. And so a good therapist can help talk you through that, or keep just enough cool on your head to get you through it. But you want to be careful about breathing. We also will give oxygen sometimes in the centers, and that helps keep your heartbeat down as well. One time I gave myself a fever bath. A person said, well, I'm coming. I said, well, I might as well go ahead and get it started and get heated up. Have you ever heard of tetania? Tetania is a condition where the body it's either deprived of oxygen or it's too much carbon dioxide. But anyway, your fingers tingle, toes tingle, and then they draw up. They kind of go numb and they draw up. And so I was sitting in 110-degree water, and I couldn't do anything. I was a vegetable, right? And I'm glad my friend came, because I was like, I can't do anything, because you just draw up. And either I would have slipped under and it would have been over, or the water would have slowly cooled down and I would have come out of it. So be careful. You can go into tetania, and that's not good.
No, that's next. Not yet.
Okay, what sheet pack?
You have to
Yeah. What we would do usually, we would recommend 102-degree temperature. You'd want to hold a person there for around 20 minutes, if you can get that long, and then go down and come up. Okay.
Thank you so much. Appreciate it. Thank you, Brent. Yes, ma'am.
We're actually watching the clock. We have it checked every 5 minutes. So if you're giving someone a fever bath, you got to be really careful. And then you're checking their pulse. You're writing it down. You're checking the water temperature and their temperature. And you are bathing the back of their head with ice. They have a whole bag with ice on it, and then you have a basin with ice and water. And you're, barely wringing it out, putting it over the face. If they want it over the face, over the head, you're keeping that head cold. Okay?
Thank you. Shari's a nurse. So I'm very thankful. Very thankful for her input. Okay, so we have to end, and we will see you back at 11 o'clock. Okay, thank you.